This film will show you what to expect if you are having coronary bypass surgery. It includes images of the surgery in progress and shows a live beating heart.
My name's Dave Burrell, I'm 55 years old and I'm from Northampton. The pains I was getting in my chest were, I thought it was indigestion. And one day, it wasn't indigestion no more, it was a heart attack. I hope I'm strong and well enough to do my job that I like. I just want just a peaceful life.
Good to see you again. How are you, sir?
I'm fine.
My name's David Taggart. I'm a consultant cardiac surgeon in the John Radcliffe Hospital in Oxford and also Professor of Cardiovascular Surgery at the University of Oxford. So the patient we're operating on today has severe coronary artery disease and he will have a lot to gain by coronary artery bypass grafting.
The coronary arteries supply your heart with blood. When you have coronary heart disease, fatty deposits build up on the inner walls of your arteries, causing narrowing or blockages which restrict blood flow. In coronary bypass surgery, arteries or veins from elsewhere in your body are taken and grafted onto the coronary artery, past the narrowed area. This means the blood can bypass or get around the narrowed sections, so blood flow to your heart is improved.
So the operation in total lasts somewhere from around 2 to 3 hours. They will have general anaesthesia, which clearly lasts throughout the operation, and for about 8 to 10 hours into the intensive care unit. One has to accept that it's a major operation and it does have risks. However, the benefits for the patient are it improves their symptoms, but even more importantly, it extends their duration of life. The operation starts by us opening the chest. We divide it in two. Most patients need 3 bypass grafts, so we have to obtain blood vessels from other parts of the body to do those bypass grafts. The second stage of the procedure is to connect the patient to the bypass machine. And that machine provides an artificial circulation which allows us to stop the heart so that we can sew on the bypass grafts very accurately. So another way of doing the operation is to do it without using a bypass machine, and that has advantages in certain categories of patients where the bypass machine can cause problems. At the completion of sewing on the bypass grafts, we then eventually disconnect the patient from the bypass machine and the heart takes its own function again. We then close the chest, and we do this using stainless steel wires. And once these secure the chest together, they stay in the patient forever. And one thing that often concerns patients is whether they're likely to cause alarms at airports or in shops. And the answer to that is they do not. So from our point of view today, everything's gone very well indeed. And we would now expect a fairly straightforward recovery. So at the end of the operation, they stay in intensive care for around 24 hours. They then go back to the general ward, and most patients need somewhere from 5 to 7 days to recover from a bypass operation. So we do advise patients not to drive for about 6 weeks after the operation, and that's because the pain from the chest wound can inhibit them moving their neck freely, so it makes driving dangerous.
It's the first time you've seen it.
It is the first time I've seen it.
It should heal up nicely.
Yeah.
And for the majority of patients, it takes somewhere around 6 to 8 weeks to get really back on their feet before they begin to really get the benefits of the operation.
Yes.
It's day 6 of my hospital experience. I've had my operation now. Still a bit short of breath, but I'm sure that'll come back. All of it will come back soon enough. And I feel quite fit. I just took life as it was, day after day, day after day. It is definitely life-changing, and people should learn more about their body and not just ignore it.
And it all has gone very well indeed?
It has gone well, yeah.
No problems or complications?
No.
Great. We do advise patients to join rehabilitation classes because there is good evidence that this helps the patient over the longer term.
I need to be more positive in the way I treat life and just get on with it the best way I can. I'll be back.
Heart disease is still the single biggest killer in the UK. But for over 50 years, we've tirelessly pioneered research that has helped transform the lives of people living with heart and circulatory conditions. Join our fight for every heartbeat in the UK. Every pound raised, every minute of your time, and every donation to our shops will help make a difference.